guys, happy Monday. I decided that this week, since you guys always enjoy my day in the life, that this week I would do days in the life, a couple days. We'll see how it goes, just depending on how busy it is at work. I'm gonna try to film as much as I can a day in the life or days in the life of a dental hygienist. And so I am about to grab my food for lunch out of the fridge, fill up my water bottle, and then go jump in the car. But I'm gonna take you guys along with me during this week, and I hope that you enjoy it. I will say that the reason I don't have more of these videos is because it's quite hard to manage being able to film at work, because there's lots of just different things that you have to go through. You can't just film whoever, you have to get permission, and then also in terms of just HIPAA, protecting patients' confidentiality, all of those things, it just makes it a little bit trickier to be able to film constantly. But I am gonna try to film as much as I can. And also there's the fact that it's busy, especially my job is very busy, and so sometimes there's just not enough time to truly pick up the camera, set it up, and really capture what's going on. So I'm gonna try to do that to the best of my ability this week, and I really truly hope that you guys enjoy. So let's go along and get this week started. Okay, so getting the day started, I usually like to come in and just do things that I see that need to be done. And so first up, we have some laundry. So we do all of our lab jackets in office, and so I am just getting those taken care of first thing in the morning, throwing them in the washer, and then I like to come into my room and kind of start getting set up for the day. So bringing the chair down, bringing a tray in that's fresh with clean equipment for the day. I was about to say clean ingredients, but fresh equipment. And anytime that you see me using my hands to touch anything, I just want to put it as a reminder that my hands are freshly washed, okay? So another thing I do at the beginning of the day is pop open the schedule, and I usually put on some jazz music to have playing in the background, as well as just a video of us pretending like we're on vacation somewhere beautiful as a backdrop, so that when people come in, they just feel a little bit more comfortable. And I found that my patients absolutely love this. Also, these videos, I find them on YouTube. I just type in 4K landscapes, and then they give us drone footage of different countries. I try to switch it up almost every day. And again, I really like to do opposite weather, whatever we have going on, or just really beautiful places makes you feel like you're really somewhere else. So that's what we have going on today in Thailand. Another helpful tip is getting the day started by restocking the drawers, making sure that I have all of the goodies I need for patients' bags, making sure that aside from those things that I have any other thing that I might need to just grab from my drawer. Makes life easier. It's right next to me. I can slide over and grab anything that I need for the day. So I am just returning to that laundry. Now that the lab jackets are all washed, I'm going to pop them into the dryer just to get this task completed. So throughout the day, we are using these trays, and so we disinfect them in between each patient, but then we also cover them up with these tray barrier sleeves. That way no liquids are spilling, nothing is splattering, and we can just take the sleeve off and wipe them down for reuse again. So here I am just bagging those trays back up before I start to put the things that we need onto them. So I actually realized that we ran out, so I went to the supply room to grab another box, and I left this clip in because this is a realistic day in my life, and these are just moments that actually happen throughout the day. And so this is me trying to fight with this box to get open so that I can finish this task as well. So now that the trays are all covered up, what I'm gonna do is go ahead and make hygiene trays. So on our hygiene trays, first up are our prophy paste. Then I'm gonna grab some gloves because I am gonna add some gauze on there. But before that, I actually went ahead and grabbed our prophy angles. So those are the little toothbrushes that we use to pick up the paste and polish teeth. Up next, I am going to grab some floss because we also floss every patient that comes in for the day. And so I'm going to add those onto the tray. And then I'm going to add patient bibs, headrest covers, and suction. And so usually we also have a blue paper, which is just called tray paper, that's in between the barrier sleeve that's plastic and all of the equipment. However, 2 boxes or 3 boxes of supplies did not come. They got lost in transit, and so unfortunately we didn't have that paper, but that's okay. It doesn't stop us from still getting the job done. So the main goal of getting these trays done is to save time throughout the day in between patients. All I have to do is come in here and grab a pre-made tray, the instruments that I need depending on what cleaning I'm doing, and then if I need anesthesia or x-ray equipment, I'd grab that too. Okay, so in this clip, you'll see that I am taking some x-rays on my patient. Today, they just needed some checkup x-rays, and so I am taking 4 bite wings. The series is 4 x-rays, 2 on each side of the mouth, and that is showing the teeth biting down in an x-ray. That way we can see both the top and bottom rows of teeth on x-rays. These are excellent for checking to see if patients have cavities in between their teeth, to see how their teeth are coming together, etc. So this is me grabbing those x-rays before we go ahead and get started. And before we do anything, we review medical history to see if there's any changes that have been made, checking to just see how the patient is doing. I always like to chit chat to my patients and ask them how things have been going in their life. That way they don't just feel like they come in, I lean them back and say, open up, you know? I like to be personable with the patients that I see. And so I am just getting started at the beginning of this appointment this way. So now that the x-rays are taken and medical history is reviewed, I am just getting my loupes on, putting my gloves on, and just getting ready to start this cleaning. And so the first thing that you're going to see me do after I put my gloves on and I'm all dressed up and, hey friend, taking out my garbage, thank you. First thing that you're going to see me do is just look inside of their mouth, checking to see how everything's looking. We're looking at soft tissue, we're looking at hard tissue, we're looking at the teeth themselves, and just getting an idea of how their hygiene is, and if we see any sort of like lesions or anything that is notable, we'll make sure that we jot that down. In this moment, there was something that was irritating my patient, and so we were just discussing what it is that I recommend to do for that irritation, trying to figure out how it happened, and we'll go from there. Another thing that I always like to do is always ask my patients if they've changed anything that they've been using, especially if they come in and have irritation. So I'm always asking if they're using a manual brush or an electric brush, which kind of toothpaste, if they're flossing. We can always tell, by the way, if you're flossing or not. We just ask to see what you'll say to us. But I like to just update and make sure that I know everything it is that you have been using, what your technique is, just in case if we need to kind of tweak it, we'll be able to do that at the top of the appointment. Honestly, it really just depends on what's going on. Sometimes that will happen later on in the visit. Really just depends, again, on what they say, what they have going on, and what it is that I see. Okay, Okay, so typically when I'm doing a cleaning, the first thing that I start off with is a Cavitron. And so Cavitron is just a brand of an ultrasonic cleaner. It vibrates at ultrasonic speed and sprays water, and it helps to rinse out the gum tissue. It helps to loosen up any tartar or debris that you may have stuck on your teeth. And it's just a great tool. It helps us to preserve our hands and our wrists, but it's also really, really good because it helps to just make it so that you're sure that you're really getting everything rinsed out of the gums and out of the mouth as well. Speaking of preserving hands and wrists, it's very important for us to make sure that we're working on our posture as well as we do cleanings, trying to be upright, trying not to bend our neck and our head over too much, because over time, hours and hours of doing that can cause different issues. And as it pertains to the hands and wrists, if you are not using your instruments correctly, that can also cause issues like carpal tunnel and cramping and other things. So it's very important to make sure that you're always conscious of your posture and your hand movements. I will say that there are definitely times where I know that I'm leaning over too much or just not necessarily having the best posture. So it's something that I'm always working on and trying to be mindful of. Nobody's perfect, but if you want to live to not be a hunchback, it is extremely important to be mindful of your posture throughout every appointment. So I know I was just talking about posture, and here I am with my elbow up to the sky. When we were in school, they used to call it a chicken wing, and they would tell us to tuck them in. So I'm just laughing at myself here. But again, like I said, nobody's perfect. I am working on it. Now, aside from using a Cavitron during a cleaning, another set of instruments that I'll use are called hand instruments. And so we have different scalers. Some can be used above the gum line and some can be used below the gum line, depending on what your patient needs. I will say that in this case, I might not even pick up any hand instruments because this patient's hygiene is absolutely excellent. And so just depends on how much buildup the patient has, but in some cases you'll see that I am going back and forth between using hand scalers and the Cavitron, and again, it really just depends on how much buildup they have and what type of cleaning it is that we're doing as well. One of the things that I happen to love about hygiene that I know sometimes people tend to just hate in general is that the job is very, very repetitive for the most part. You're doing the same sequence of things in the same order as well throughout the day, throughout the week. And I can understand how for some people that can be very boring. But for me, I genuinely love doing this. It brings a lot of peace and joy to me. I find as well that when there is a method, that it makes it so much easier to stay on track, and it just, like, I know what to expect. And so for me, I really don't mind it. I know some people just find it to be so boring and can't wait for the task to be over, but for me, seeing the before and after is like an amazing transformation, especially if you have somebody who has a lot of buildup. I love to see the before and after. It really is a motivator for me. And also seeing the patients be so happy and content is also just like a boost for me. So it can be very repetitive, and let me not even say it can be, it is extremely repetitive, but I don't mind it at all. So here I am now, just going over every area to make sure that there is nothing left behind, just checking every single tooth to be sure that I've gotten everything out. And I'm going to move some of the equipment out of the way because up next we are going to be flossing. So I actually had somebody tell me that like hygienists are professional flossers because literally nobody in this world flosses more than we do, because not only are we flossing our own teeth, we are also flossing every single patient it is that we see. And I thought that was very funny because I never really thought about it like that, but it's the truth. Nobody's flossing more than a dental hygienist, and there's plenty of times that patients may come in and they also say like the last time they flossed was when we did it for them. And again, like I'm never here to judge, but nobody is flossing more than we do. So I also really like to take the stance of being an encourager rather than a reprimander, because I find that it goes a long way with the patients. There are plenty of times where people are feeling uncomfortable, they're feeling like they're being judged, or they might have fallen off their routine and they're already feeling bad. So I always like to say that I'm never here to beat anybody up, really just to encourage them to get back on track, teach them the things that they need to know in order to be successful and have better hygiene at home. And also, I know that most people at least, hate coming into the dentist. And so dreading coming in or having a fear of coming in and then getting there and having somebody who is mean and hard on you, it really just doesn't help add to the experience. And so my approach is always, hey, I'm going to let you know where it is that you're at, but I'm going to encourage you that wherever you are, you can be doing a better job, but also that I'm not here to really just be rude or to be mean or to make you feel bad about where it is that you are. And then also there's some people who literally do not care. So it really just depends, but I like to be an encourager rather than a reprimander. I find that it really does go a long way. So whenever I have patients that come in and they have a lingual bar, or we call them lingual retainers, those are the ones that are kind of glued in or bonded into the teeth. They're on the inside row. I like to start off flossing those first because it does take a little bit more time. It's a little bit more tedious. And so that's why you are seeing me grab a long piece of floss secondary. But I start off first with the retainers if they have any, or bridges if they have any. And then I go in with the regular string floss and do the rest of the mouth. I also like to try, if I can, to leave time and space for patients when they have questions about things. I don't want them to feel rushed. Even if we are on a time crunch, I like them to be able to ask questions and get feedback from me as well. Okay, so next up, you will see that I am polishing my patient's teeth. And so it really just depends on who it is that you see and where you're at. Some hygienists like to polish before they floss, and then there are others like me who like to floss immediately after the main cleaning and then polish last. I will say that there are certain times where there are tiny little pieces of debris that are in between the teeth that the only thing that's thin enough to be able to get it sometimes is the floss. And so I find that that's the best result for just making sure that everything is truly out of the way. And if there's anything that you might have missed with your other instruments, you'll definitely be able to scoop it out with your floss. And so I'll floss and then I'll polish last. I will say that some patients absolutely hate the polishing because inside of the prophy paste, there are little pieces of like pumice, and so it feels really gritty, kind of feels like you have tiny little like crunchy pebbles in between your teeth or in your mouth in general, and some people absolutely hate that. And so it really just depends, but I happen to love the polishing. I think that that's like my favorite part of the cleaning. Or maybe every part is my favorite part. I don't really know, but I will say, like, when I'm getting my teeth cleaned after I get them polished, everything feels so smooth and slick, and I love that feeling. So after after polishing the teeth, last thing that we'll do is rinse the mouth out really, really well. And so I like to start off by using the air water syringe to spray some water in the mouth because that paste is extremely thick. But then I also like to sit my patients up and offer them a cup with water. That way they can take their time and rinse and swish themselves. It really just depends on what we have going on. Sometimes I'll also give them a little bit of Listerine. Make sure that you're using 0 alcohol mouthwash no matter what. But then I also like to give them a damp napkin just in case, so they can wipe off their mouth and get all of that grit and all of that feeling out of the way. Once I'm done, I always like to ask if they have any questions before I go and grab the doctor. Once I am all finished with the patient and the doctor has done their exam, I will start to break the room down, clean everything. So I usually like to start off by throwing away everything that's disposable first, and then I will spray the chair down and start wiping everything. I also like to get the tray out of the way. I find that just makes it a little easier so that I can really focus on wiping everything down very thoroughly. This is something that is very important in between patients. You don't want to leave any splatter behind, any blood, any toothpaste, or anything like that, and you want to make sure that the environment is completely disinfected before you go and you grab another patient. So my chair is a little bit up in the air because this was my last patient, and so I am just going to be cleaning everything, making sure that everything is all set and clean before I end my day. So I didn't capture every single aspect of breaking the room down because I didn't want to bore you guys, but when we're wiping our rooms down and cleaning them, we use Cavicide or Sani wipes, really just depends on where you are, in order to make sure that everything is disinfected. And towards the end of the day as well, I kind of sometimes do a little bit of extra wiping just to be sure that everything is really just clean and disinfected before I end the day. Thank you guys so much for tuning into today's video. If you have any questions, please leave them down below, and I'll catch you in the next video. Bye.